CFOs traditionally in the healthcare space have prided themselves on being able to figure out the very, very convoluted reimbursement methodology that is out there today. And as patients, we have all experienced getting a bill and then getting a second bill that we weren't expecting and trying to figure out what that bill was about, why it was as much as it was, who do we go to? And even though it says explanation of benefits, EOB, sometimes the explanations are not all that clear. The CFO not only has now the challenge of meeting a completely different reimbursement model and dealing with the change in the transformation of that reimbursement model and what it means in terms of cash flow and financial planning, but becoming also a very, very friendly, consumer-driven billing system. So having a very, very clearly defined pricing schedule and having patients understand exactly what the value of that pricing is and why that is a good thing for them to have is part and parcel of the CFO's challenge. So if we look at other industries, other CFOs have figured this out. And let's go to the retail health in, let's say, the CVS or the Walmarts. When you go for an immunization or you go for a strep throat culture, it is very, very clearly listed when you walk into that corner office and it says these are what the prices are. Patient knows exactly what the price is. CFOs are going to start driving and need to start driving pricing and the billing model when it comes to transparency to that level. And that's going to be incredibly difficult given that we're going to be going through a transition of the current reimbursement model that it's in place to date to the more fee-for-service, fee-for-quality model that'll be in place now and for the next 5 to 7 years. Well, unfortunately, it probably won't help what we'll say is the payment issue because if patients have the ability to pay 9 times out of 10, they pay, and if they don't, they don't. And it's not usually on the question of the bill. It gets down to, again, to choice. Given as a consumer, I can now decide what facility I go to, what physician I go to, even what health plan I choose. I mean, now you can choose health plans and change health plans within the current year, whereas before you were bound for a 12-month period, not being able to change. So as a CFO or a financial person, I need to be incredibly receptive to our patients walking away because they feel that the value is not worth the price. And that is something that we see in a lot of retail areas, and that is something that healthcare is going to be dealing with over the next 5 years.